A House leader has dared PhilHealth officials to sign bank secrecy waivers to pave the way for an investigation by the Anti-Money Laundering Council. But even before he could respond to this challenge, PhilHealth President and CEO Ricardo Morales had to leave the chat room as he was not feeling well. To give us more details, Ria Fernandez reports live from Quezon City. Ria, what do we know so far based on the House hearing?
Charles, some PhilHealth officials took on a lawmaker's challenge to disclose their bank transactions. In the same hearing, though, some representatives of the agency admitted to receiving allowances from the accreditation fees by hospitals. House lawmakers continued to quiz PhilHealth over the alleged rampant corruption in the agency. Deputy Speaker LRay Villafuerte dared PhilHealth officials to disclose their bank transactions to the AMLAC. Officials present in the hearing accepted the challenge, but Morales, as well as EVP Arnel de Jesus and Legal Chief Rodolfo del Rosario Jr. eventually left the virtual hearing due to medical reasons. Meanwhile, House Public Accounts Chairperson and Anak Kalusugan Representative Mike Defensor reiterated that the so-called PhilHealth mafia thrived due to the agency's all-case rate policy, where PhilHealth pays hospitals on a package rate for a certain disease, regardless if actual hospital fees are lower. Defensor noted that the Commission on Audit has time and again flagged the said policy since its implementation in 2013. Citing COA, the lawmaker added that PhilHealth also paid several hospitals despite the absence of claims. With this, Defensor is convinced that a collusion between hospitals and PhilHealth exists. He is also bent on filing plunder charges against PhilHealth officials down to those at the helm of its regional offices. In the same hearing, PhilHealth Senior Vice President Israel Pargas and Renato Limsiaco Jr. admitted receiving allowances out of PhilHealth accreditation fees made by hospitals. But when Deputy Speaker Dante Marcoleta tried to probe the amount, Limsiaco suddenly cleared himself.
Sorry po, talagang hindi ko matandaan po kung magkano yung pera po na binibigay po sa ating mga recipient po noon. Dahil po ako ay hindi po ako isang medical officer po na binibigyan po ng ganong allowance dati po, Mr. Chair, Your Honor.
In defense, Pargas said the practice started in 2008 and was based on a board resolution. He said each of them received around 20,000 pesos yearly, but it was eventually disallowed by the Commission on Audit in 2014.
Kanina sinabi niya, meron silang monthly tinatanggap. Siya mismo nagsabi, naka-record tayo eh. Ngayon sinasabi na naman niya, hindi monthly. Paiba-ibang sagot ng mga tao na yan.
At this point, some lawmakers were convinced that PhilHealth officials are just covering up for one another. With his Deputy Minority Leader Carlos Zarate described the state insurer as having a failed system. Minority Leader Benny Abante ordered the agency to submit further details on accreditation fees paid by hospitals. The state insurer said it collected an average of 27 million pesos of the said fees for years 2018 and 2019. Charles, the House committees hearing the alleged fraud in PhilHealth will immediately issue a subpoena for the SALNs and ITRs of the officials of the state insurer. Meanwhile, they will also release a show cause order against the PhilHealth officials who missed or skipped the hearing, including General Morales. Charles?
Thank you. That was Ria Fernandez reporting live from Quezon City.